The radiologist agreed with the choice of a PE protocol CT and prescribed the exam and associated intravenous contrast electronically, which took about 30 seconds. This all happened so quickly that the technologist was immediately able to see the signed protocol and carried out the exam as soon as the patient arrived from the emergency room. Because all studies from the ER were flagged as stat in the ordering system, the resulting images showed up on top of the radiologist's electronic work list as soon as the study was completed. When the radiologist interpreted the study 15 minutes later, she found several issues. Indeed, John Doe did have a pulmonary embolism, and the radiologist initiated the critical finding pathway, which documented electronically when the finding was reported back to the ER via direct communication. When the ER physician wanted to see the amount of clot present in John's pulmonary arteries, the radiologist used an internal online collaboration tool contained within the PACS system to demonstrate the findings to the ER physician, who found this very helpful. He could immediately see that John's case could be managed medically. The radiology department also used the system to track turnaround times and closing of the communication loop on such critical findings. This helps the department in their continuous quality improvement efforts. The radiologist also spotted an incidental liver lesion in the dome of the liver of John Doe. When the radiologist entered all the pertinent imaging characteristics, the ACR Assist system suggested that this finding met the criteria for a LIRADS-1 benign liver lesion that did not require any follow-up or further management. ACR Assist had been built to recognize when a radiologist was describing a finding for which a classification or follow-up recommendation had already been established in the literature or by practice consensus, and to advise the radiologist of this insight. By providing an appropriate lesion classification, as in this example, using the Liver Imaging Reporting and Data System LIRADS, the ACR Assist system guided the radiologist to correctly classify even a finding she would not often encounter. In general, it also helped with getting consistent reads when several radiologists interpreted imaging in sequence. Because the ACR Assist system led to correct characterization and documentation of John's liver lesion, including the fact that no follow-up was needed, John was able to avoid a future potentially unnecessary follow-up imaging study for the same liver lesion.